Welcome back to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today, we will meet Shelley, Neal, and Arlene Ferebee, who are going to give us some more information about the health insurance marketplace. Next, we will meet Dr. Jonathan Woods, who's a nephrologist in the area. Stay tuned to learn about valuable health topics with HealthWatch. Our first guests of the day are Novant Health employees, Shelley, Neal, and Arlene Ferebee. Welcome, Shelley and Arlene. It's such a pleasure to have you guys here today.
Thank you.
So let's begin by learning a little bit about each of you, your education, and your background. So Shelley, we'll start with you.
Sure. I'm Shelley Neal, and I work in business development sales with Novant Health. I've been with Novant Health for 8 years. I work with a team of folks that manage the relationships with the insurance carriers. One of my primary roles over the last couple of years is to track the development of the health insurance marketplace.
And that's a big job.
Yes.
Big job.
It's progressed over time,
Right.
from state-based to federal exchange. Yeah.
Mm-hmm. And how about you, Arlene? How are you involved with Novant Health?
I am the Director of Strategic Development, and I work with Novant Health's strategic planning team. Mm-hmm. And what I do in that capacity is work on new business development initiatives, especially projects that span all of our markets, and the health insurance marketplace is certainly one of those projects.
Certainly it is. Now, I understand that you recently helped to host an event at Novant Health Brunswick Medical Center, and it had to do with a new marketplace exchange or market. What is that really called? See, I can't even.
It's the health insurance marketplace. And yes, we held an event just yesterday afternoon at our Novant Health Brunswick Medical Center. It was an information and enrollment outreach event for the community, and it was very well attended. We had lots of people coming with questions. Mm-hmm. As you might imagine, people are a little confused and need a little help navigating the marketplace. And we had trained Novant Health staff on site, as well as qualified insurance agents and brokers, and members of the Department of Social Service there to assist people. So individuals could come in and get their questions answered, apply, complete the marketplace application, check to see if they applied for low-cost premiums or subsidies, and also enroll in a plan.
So they were able to enroll yesterday.
Yes, the marketplace was actually up and running.
It was open for business.
Yes.
Open for business.
Well, Shelley, let's shift to you a little bit. Who actually is eligible for coverage through the marketplace?
Sure. The marketplace was developed to build on our current system. Uh-huh. So the primary goal is for everyone to have an affordable option of health insurance. Mm-hmm. So people that are currently uninsured or purchase their own insurance is eligible for coverage to the marketplace. Some individuals and families may qualify for a subsidy. Subsidies are determined based on your household size and household income. So if you purchase insurance to the marketplace, you could qualify for that subsidy. And what I mean by subsidies is the federal government could potentially pay for part of your premiums, depending on if you qualify or not.
I see. So that tells me who might be eligible, but I suppose there is a group who might not be eligible. Can we touch on those for a moment?
Sure. Unfortunately, not everyone is eligible for coverage to the marketplace. Some examples would be undocumented immigrants and folks that are currently in prison. Mm-hmm. Also, if you have coverage through Medicare or Medicaid, or coverage through your employer, or a family member's employer, then you would want to continue with that coverage.
I see. Well, tell me, what types of health care will marketplace plans cover?
I can answer that.
Great.
The marketplace plans will cover doctor's visits, hospital care, and prescriptions. It'll also cover maternity care and preventive services. And if you're an individual who was not able to purchase health insurance before because of pre-existing conditions, you now have the opportunity to purchase coverage.
I think I did see on TV one of the commercials that said no longer are pre-existing conditions taken into account with the new.
That's right.
And so I think that is a great thing.
Right. It's not taken into account for your premiums, the rate setting, or if you're eligible or not. So everyone can receive coverage.
I think that's a great thing right there. Where might our viewers go to find these plans that are available?
Okay, they can visit healthcare.gov.
Okay.
You can also talk to a person directly through the healthcare.gov 800 number.
I see.
You can visit healthcarenc.org and find a trained agent that may be available in your area. And you also can go directly to Blue Cross and Blue Shield, that's bcbsnc.com, to view available plans.
Would it be possible for them to speak with their own insurance agent or an insurance agent in their community that they might know? Is that a possibility?
Yes, but if you want to see if they're trained through the marketplace, you can visit healthcarenc.org.
And that's an important piece, that they talk with somebody who's been certified.
That's right. Not all agents and brokers have gone through the training. A majority of them probably have, but you can view the agents that have through that website.
Okay, so we've kind of covered that part. Now, how do we enroll in the marketplace? Let's talk about that a little bit.
Sure. To enroll in the marketplace, you have to go to healthcare.gov.
Okay.
Or an agent or broker can assist you with that enrollment process. You can also talk to a navigator or certified application counselor, but an agent or broker probably be the best resource.
So, okay, now I'm ready to apply. So what kind of information do I need to have at my fingertips to begin this application process?
Well, anyone who's applying will need to have a Social Security number. They'll need to bring either a W-2 form or a pay stub. And if you currently have insurance, you'll want to bring your policy numbers as well as any information about a plan you may be covered with through either your employer or through a family member's.
And where can our viewers learn more about the health insurance marketplace other than the two websites that you've cited? Is there any other way to get this additional information?
Well, at Novant Health, we've tried to simplify things for your viewers and all of the individuals in the communities we serve by consolidating things on our website, which is novanthealth.org/health exchanges.
Okay.
And if they log in there, we've got a lot of frequently asked questions posted. We have information about outreach events that we're holding in various markets, as well as links to some of the sites that you have been previously referenced. So it's a nice one-stop location for people to get information.
Now, we mentioned earlier that folks out there can actually go talk to a broker. If they're unsuccessful on the website or they just have additional questions, they could go to a local broker and talk to them. But I'm curious about the information they might get in terms of cost. Would it be more expensive to do it that way as opposed to the website?
Well, actually, for the individual that's looking into the marketplace, whether they purchase in the marketplace or not in the marketplace, whether they purchase through a broker or they walk through the process on their own, the cost of the premiums is exactly the same. So they needn't worry about reaching out to a broker and having to pay an additional fee or commission.
Okay. Now I have one more question about the broker. If they go to the broker and try to enroll, would they be eligible for the subsidy?
Absolutely. They have to enroll through the marketplace, and the broker can assist them with that. But if you enroll through the marketplace, then that's where you see if you qualify for a subsidy or not. And the agents and brokers really can help explain the plan options. That's one of the benefits of talking to our agent or broker, to understand the options and the benefit levels.
Mm-hmm. Well, from my perspective, I would think it would be kind of nice to have a person there that you could dialogue with,
Yes.
in addition to the computer and signing up for the marketplace. It's just, sometimes I just prefer to do business face to face.
Right.
And so I think that, a broker might be real helpful.
And you're going to have questions.
Sure.
At the event that we recently held, people came in with lots and lots of questions, and there's nothing better than to have somebody right there to step you
Sort of
through
hold
it,
your hand.
do an apples-to-apples comparison, let you address any questions that you have.
Okay, now I understand that if I qualify and I can go through all the steps and eventually get to enroll in the program. But let's say that I don't qualify. Are there any options out there available to me because I still don't have health insurance? So what options might I take advantage of?
Yes. First, you probably need to make sure that you're not eligible for anything through the marketplace.
And so that's going through the whole process.
That's going through the process. So that's important for people to try and see what they are eligible for. And if you're not eligible, there are options out there for folks that are uninsured, and I would recommend that you start with a financial counselor at Novant Brunswick Medical Center.
Let's talk about the timeline. When do I have to have this application made? And then how soon would my insurance take effect, and so on and so forth?
Okay. Well, enrollment started October the 1st of 2013.
Okay.
For your policy to be effective January 1st, 2014, you have to enroll by December 15th, 2013.
Well, that's quite a long time for it.
Yes,
folks
but
to...
the initial enrollment period is extended through March 31st, 2014, but you will not be effective January 1st if you don't enroll before December 15th, 2013. So you still have an option, but your effective date will not be as early as January.
Okay, again, so you have to enroll prior to December 15th?
Yes.
And the insurance will take effect January 1?
Yes.
But if I apply during January to March, when would my insurance take effect?
Well, if it's before the 15th, it'll be the following month.
Oh.
But if it's the 16th, say it's January 16th,
Yes.
it will not be effective until March 1st.
Oh, that's a time there.
Yes.
Yeah. So you would encourage everyone to apply as quickly as possible.
Absolutely.
And, especially given some of the difficulties folks have had and maybe getting together all their information, it's probably better to start the process as soon as possible.
Absolutely. And if you haven't had health insurance before, I would think that you would want to get coverage as soon as possible. So if you meet that December 15th deadline, you'll have availability come January 1st.
Sure.
Right.
Those are great points. I appreciate that. Again, thank you so much for joining us today. It's been a pleasure having both of you, and I look forward to talking with you again to see how successful the enrollment has been.
Thanks, June.
Our next guest is Dr. Jonathan Woods of Southeastern Nephrology Associates. Well, welcome to the show today, Dr. Woods. It's
Thank you.
Such a pleasure to have you. I'm so happy that you're here, and I can't wait to get started.
All right, thank you. I'm glad to be here.
Good. Now, how long have you been with Southeastern Nephrology Associates?
I joined in 2005, so this will be going on my 9th year. Yeah.
And where did you get your training? Where did you go to school?
I did undergrad and medical school at University of North Carolina, Chapel Hill, and then I did my internal medicine nephrology training at Wake Forest.
Oh, great. Great background.
Yeah.
So you've been here since 2005.
Correct.
And where were you prior to coming to the Wilmington area?
I came straight out of
school?
Straight out of residency.
Residency?
Yes, I did.
Oh,
So
wow.
I grew up in Raleigh, so I always
Did you?
wanted to get. We were down here visiting all the time, so I always wanted to get to this area. So I was
So
glad
you're
to make it.
familiar with the area.
Yes.
Oh, that's great, great. Well, we're really glad to have you, as I said, and I wanted to first start off with telling our viewers what a nephrologist is. That's kind of a long word, and Not so sure I know what that is, so
Right.
let's start there.
And you're not alone with that. Nephrologists, we specialize in treating diseases of the kidney, and we really deal with how the kidney functions. The role of cleaning the blood, handling all the electrolytes, the potassium and the sodium and things like that in the blood. We also deal a lot with high blood pressure because that's largely regulated by the kidney, and the kidney plays a very big part in that. So we mainly focus on the function of the kidney. Now that's different. A lot of people get us confused with urologists, who are surgeons who deal with the kidneys, and they would be the ones that removed a kidney or took kidney stones out or did surgical procedures. But we're more along the actual function of the kidney aspect.
Kind of like an internist who looks
Exactly.
only at the kidney.
Correct.
So there is some relationship between the two.
Yes.
I mean, oh, good. Now that's a great explanation. I think I have it.
All right.
So let's talk a little bit about who might have risk for kidney disease.
The biggest risk factors in the United States for chronic kidney disease, and by chronic kidney disease we mean people whose kidneys don't function normally, and it's been that way for a while, but they're not yet on dialysis. They're not yet bad enough that they need dialysis to stay healthy. The two most common reasons for that in the United States are diabetes and high blood pressure. And this area of the country particularly, that is a significant problem. So we have a lot of patients here at risk. And given the epidemic of obesity as well, which contributes to the high blood pressure and diabetes, it's something that puts a lot of people at risk in this area. So, but those are the two biggest factors that contribute to chronic kidney disease.
Well, what kind of approach do you take when a patient suffers from kidney disease? Where do you start?
The first thing that we do is try to figure out why it is. And we presume because diabetic kidney disease and high blood pressure related kidney disease are so common, a lot of times that's presumed to be the reason. There are a list of other primary kidney diseases, and quite a long list, that attack only the kidneys that aren't related to other disease processes. So the first step is understanding why the kidneys don't function normally. After that, we tend to worry about, is this patient going to progress to a point where their kidney disease can't keep them healthy? They require dialysis. And there's a lot of different factors that contribute to that. And there's a lot of, and the biggest things revolve around controlling the other factors such as diabetes and high blood pressure. So once we have the cause, we try to keep people's kidneys healthy as long as possible. And after that, if we find people are progressing anyway, which some people, based on their kidney diseases, despite the ultimate therapy and treating them as well as we can, their kidneys will still continue to decline, preparing for what we're going to do at that point, whether it be dialysis, transplantation, and making preparations for that. So ideally, we try to delay it as long as possible through strict control of other comorbidities and other factors.
I see.
But then also be aware and prepared for if it does come to a point where those interventions haven't helped.
So typically you would probably receive a patient from an internist or a family practice physician who identifies their patient at risk for kidney disease.
Correct.
And they would come to one of a nephrologist in your group, and you would begin the preparation. You would try to maintain them, but then begin the preparation for that next step.
Correct.
Is that correct? So it would be very important for a patient to see a nephrologist before the dialysis, before.
That's right. That's right. And just to back up, the kidney function is really determined by blood tests. You can determine how well your kidneys are functioned by simple blood tests that are done routinely or recommended to be done routinely in patients who suffer from diabetes and high blood pressure. So once that's noted to be abnormal, then people are usually referred to us. But to your question, a lot of people will say, well, if the biggest thing is controlling diabetes and high blood pressure, that's what my primary care physician's doing. How can you benefit? And the kidney, as I mentioned, does a lot of other things. It regulates your bone health. It contributes to anemia. Blood pressure control is different when the kidneys don't work well. So there's a lot of things that we specialize in taking care of other than just controlling the blood pressure and diabetes. And like you said, there are options available. There are different dialysis modalities, transplantation, that if we see people at the last minute, we've lost a lot of possibilities for options. We can only do emergency things at the last minute, and then that keeps people from a lot of different options.
So your goal with patients with chronic kidney disease, what might that be for folks who are not on dialysis? What might your goal be?
The biggest thing is trying to delay dialysis as much as possible. But also being forthright with the patients who show evidence that they are progressing, that they may be getting worse. And there is very good evidence that patients who get transplanted prior to ever getting on dialysis do much better with their kidney transplant. You can have a kidney transplant when your kidney function's less than 20% of normal, even though you can't go on dialysis until you're less than 10% of normal. So the studies show that patients, the kidney outcomes in transplantation are much better if you've never been on dialysis. So again, recognizing early who's likely to progress and who may benefit from preemptive transplantation or other interventions to avoid dialysis.
I do want to talk about transplantation, but before I move on to that, I wanted to talk a little bit about dialysis options.
Okay.
I know that there is such a thing as home dialysis.
Correct.
And then I know of patients who are in dialysis at a unit and so forth. So if we could just talk about the home dialysis a little bit and the different types of dialysis.
Dialysis in general involves using a machine to clean the blood in place of the kidney.
Right.
So the conventional dialysis involves people going to dialysis unit 3 days a week, usually for 3 to 4 hours at a time, and basically connecting to a machine, and the blood circulates through the machine, and the toxins are removed that the kidneys aren't doing.
Right.
There are other types of dialysis, one called peritoneal dialysis, which involves putting fluid in the abdomen, and it does the cleaning of the blood through a procedure where the fluid sits in the abdomen and pulls the toxins out of the blood, and that can be done at home. It can also be done at home at night, where people hook up to a machine.
Really?
Their dialysis,
that would be great.
Dialysis is done while they sleep. They get up during the day, and then they have their days free and are not required to be at the dialysis unit. We also have the type of dialysis that you do, the hemodialysis that you do at the dialysis unit is available to be done at home as well. It's typically done 5 days a week, but it's done a little bit shorter, 2.5 to 3 hours, but it's done at home in your easy chair. You can turn on a movie and do your dialysis at any time that you choose. So here in our Charlotte unit, we do have peritoneal dialysis center. We do the home hemodialysis out of the Wilmington unit, but that is an option that's here in Brunswick County.
Well, are there particular patients that you identify that are better candidates for home dialysis? Is that a?
I think anybody
could be
a
potential candidate.
The biggest things that limit people are, for our diabetics, eyesight can be an issue. I think dexterity is important. And having a home environment. If people live alone, it's a little more worrisome. But outside of that, I think pretty much anybody, it's extremely simple. It gives people their freedom. And like I always say, dialysis should fit around your life and not the other way around. And it gives people that option. So there's not many people that we'll say no to. And we'll give them a shot and see what we can do.
That's awesome. Well, to shift the focus a little bit, you have touched on transplantation, and I know from personally talking with you, you're very passionate about organ procurement.
Yes.
So let's move into that and talk about transplantation a little bit and where we get those organs from.
Right. Transplantation, for most people, particularly our younger population, should be considered the goal, the ultimate treatment for kidney disease. Dialysis, in the mind of a nephrologist, is something that bridges people to transplantation. And that's what I try to encourage people. If people get discouraged about going on dialysis, that this is just something to tide you over till you get your transplant.
Really?
As far as the people waiting, there's 80,000 people waiting for kidneys in the United States right now. And the biggest problem we have is that 3,000 names are added to that list every month. And that's something that we've got to change. Hopefully technology's down the road, but right now our real focus is we've got to have people donate their organs. We can't have people taking good organs in the ground. We've got to have people donating their organs. And compared to dialysis, there's very good data that both quality of life and life expectancy is extended with transplantation. And so I know it's the motto or maybe even cliche of giving the gift of life, but it truly is something that can be done that will extend life expectancy for people. And just agreeing, when people sign up for driver's license, and just agreeing that, I'll be an organ donor is such a simple thing to do, and it will extend somebody's life. And I am very passionate about it.
I can tell that you are.
It's a frustrating thing to see when people are hesitant to do that.
Yeah, I know. I myself am an organ donor and have been ever since I got my driver's license, which was many years ago. But I think that people are often just have a fear of it. I think maybe we need to publicly talk about it more and get the word out there, because it doesn't hurt you. It's not going to hurt to give that organ.
Correct.
And then we need to talk with our families about it to make sure that actually does happen.
That's
because whatever I can do to help somebody else after me, I'm all for.
Right.
So I think that I'm glad to hear you talk about it so passionately, and hopefully our viewers will sign up to be an organ donor after talking about all this. Is there a way to get more information about organ donations and
Donate Life North Carolina is a very active group here in the state, and there are Donate Life groups all over the United States. But there is a Donate Life North Carolina. I know that they're on Twitter, they're on Facebook, they're very active. And that's a great place to get information. It also gives information about living donation. I've been surprised at the number of people who have stepped forward for my patients and decided that they would give a kidney. There's good data following people long term.
That's a great gift.
It really is, and there's very good data long term that is suggesting that people who donate a kidney are at very, very minimal risk for worsening kidney failure down the road. And now we're working even with paired donations. So if you want to donate for someone but you don't match, they'll find someone else in the United States that it does match, and then they've had pairs up to 18 people matching the organs, trying to find a combination of people that can donate.
That is such an awesome
We're getting very
story.
aggressive with even living donors. So.
Wow, that's great. Well, I can't thank you enough for all this valuable information. I have learned a lot, and I know our viewers will be so appreciative of what you had to say. And I think the organ procurement conversation, it's a great place to begin, and I hope that many people will have that out in their communities. And I know that I'm going to visit that website and see how many opportunities I can find to actually talk about that. So thank you for that.
Yes, ma'am.
And how might we contact you? Do you have, can we call you at your office to schedule appointments, and how can we do that?
The best way to do is, like I said, it's a very easy blood test to determine how well your kidneys are functioning.
All right.
And I'd recommend that everyone with diabetes, high blood pressure, or even at your yearly screening physicals, request that be checked, that your kidney function be monitored. And if there's any abnormalities, that we're easy to find. We have plenty of locations that people can find us.
And I know you're in Brunswick County, right?
We have an office in Supply, that is correct. We have an office in Wilmington, Jacksonville, and Whiteville as well. So.
Great. And you're accepting new patients?
Yes, ma'am.
Great. Well, thank you again so much.
It's my pleasure.
So appreciate you being here, and I hope to see you soon.
Thank you very much.
Thank you for tuning in to ATMC TV's HealthWatch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.coop. Please visit novanthealth.org for more information on Novant Health Brunswick Medical Center, local physicians, and general health information. Thanks again for joining us today. Be sure to join us next time for HealthWatch on ATMC TV.